Hi, my name is Wendy. I'm the midwife on call today, and I'm just here to do a normal newborn exam. Um, I heard a little bit about your case. So you were 40 weeks and 1 day, had a normal vaginal delivery without any complications. Great job. So here, looking at baby, she's awake, she's alert, she's moving her arms and legs, she's moving her head side to side and following my voice. Looking at her respirations, they are rhythmic, they're 40 to 60 per minute. She doesn't have any nasal flaring or any retractions, that sucking in of the chest along the rib line. Going on, looking at her skin, her color is nice and pink. I don't see any lesions or lumps or bumps that are notable. Looking at her hands and feet, there's a little bit of that bluish purplish tinge, which is normal. That's called acrocyanosis. That usually resolves within the first couple of days. Doing the Moro or the startle reflex, holding up the arms and letting go, and she pulls them back. That is very normal, appropriate. Inspecting her hair and scalp, she's got some hair. Looking at her skin, I don't see any bruising or scratches. That all looks appropriate. Feeling the fontanelles, the sagittal suture is down the middle, which is appropriate. Her bones are nice and firm. The anterior fontanelle is nice and soft. That resolves and closes within 9 to 24 months. The posterior fontanelle closes around 2 months. Neither one of those are either bulging or depressed. Bulging would indicate increased intracranial pressure. Anything that would be depressed would lean towards a little bit of dehydration. And she does not have those. She's appropriate. Measuring her head circumference, just above the brow line. Her head is about 13.5 inches, which is appropriate for her age. Looking at her facial symmetry, she looks very symmetric while she's here crying a little bit. Her eyes are symmetric, they're clear, the sclera are white, her pupils are round and equal and moving equally together. Looking at the external characteristics of her eyes, the placement is level. Her outer canthus is level with her ear, the tops of her ears, which is appropriate. The intercanthal distance is about 1/3 of the distance from the external, so that from the outside of each eye, which is appropriate. The conjunctiva is white and she is moving them equally. Assessing cranial nerve number 2, the pupillary response. I'll grab my pen light, and using this pen light, her pupils are equal, round, and reactive to light. Then grabbing my ophthalmoscope, holding that about 6 inches away, I can see the red light reflex in both of her eyes, which is appropriate. Looking at her ears, I'm seeing the pinna, pulling those forward. There's adequate recoil. They are firm and round. They're even and symmetrical. Once again, the top is equal to the eye. There's no periauricular sinuses or skin tags that are noted. Inspecting the nose, it is in the center of the face. Looking at the nares, they are midline. There's no evidence of septal deviation. They are appropriate in size. Testing for patency, pushing in on one of the nostrils at a time. She is still able to breathe with each one individually, so that's good. Assessing tongue movement, I can see she's moving her tongue around in both directions, up and down, side to side. Assessing, that's cranial nerve number 7. Cranial nerve number 5 is the rooting and sucking. running the finger along her cheek. She's moving towards my finger. With a gloved finger, I will feel for her hard and soft palates. They are intact. Looking at the floor of the mouth, I don't see any evidence of a tongue tie, which is that bottom frenulum. It doesn't look too tight. There's no heart shape of the tongue when she sticks her tongue out. Her lips are equal, pink. The buccal mucosa is moist. Doesn't look like there's any signs of yeast or any malformation there. The gums are intact and pink. Also, the top lip, the frenulum, is stretchy, so no issues there. Sucking coordination, she's got a nice strong suck, which is good for breastfeeding. Sounds like she was doing good there as well. Going down to her neck, just palpating here, I don't feel any masses. It doesn't appear to have any webbing. The tracheal position is midline. Looking at the anterior chest, palpating the clavicles, they're intact. I don't feel any crepitus. Looking at her chest, I can see her sternum protrudes just a little bit here. That is normal at her age. Looking at her skin, there's no evidence of rash or lesions, no bruises. It is appropriate size. Looking at her areola, they are equally distanced. The breast buds are about 1 centimeter each. Auscultating for breath sounds, I'm gonna auscultate for 1 minute in each lobe. Listening for crackles, wheezes, rubs. Everything sounds normal or appropriate there. I'm also going to auscultate for heart sounds with both the bell and the diaphragm in all 5 points: the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral. Listening for murmurs, clicks, gallops. Everything sounds appropriate. No abnormalities there. Looking at her abdomen, while I've got my stethoscope here, I'm going to auscultate the bowel sounds. They are active. Sounds like she's already had a bowel movement, so that's great. I'm going to, looking at her umbilicus, it is still clamped. She's not quite 24 hours old yet. We'll take that off after 24 hours, making sure that it is nice and dry. There's no redness, erythema, herniation. Doing some light and deep palpation. Feeling about 2 centimeters under the rib cage on the right. I'm feeling for the liver. And then on the right side, the spleen is not palpable. Going down to the femoral pulses, they're both equal and strong, not bounding, but equal. Looking at baby girl here, her labia majora, there's no swelling. There's a little bit of creamy white discharge, which is normal, and it can be pink as well. That varies just a little bit depending on hormones. Inspecting, looking for patency of the anus. Baby's already had a bowel movement, so we know that's patent. Opening the labia, looking at the perineum. That all looks great. Up to her arms, we're going to palpate the humerus bilaterally. They are intact and firm. Doing range of motion at each elbow. Good range of motion. Looking at the palmar creases, those are intact and equal. Using hand tone, we're looking for the palmar grasp, which she's got very strong hands. There's no webbing. There's 5 fingers on each hand. Bending at the wrist at 0 degrees, there is the square window. Very good. And then doing the scarf sign, pulling one arm across, and there is good resistance there. Pulling arms down, she pulls her arms back up with great recoil, and palpating the brachial pulses. They are intact, equal, and strong. Now I'm going to turn her over to look at the thorax. The skin is intact. The spine is midline. I don't see any abnormal coloring, no rashes, no lesions, no bruising. I'm not feeling any masses over the back of the thorax. Palpating the length of the spine. There's no skin irregularities. The spine is straight and midline. Doing the truncal incurvation reflex on both sides, running my hand down each of the sides here, and she curves towards the side that I'm touching, and that is very appropriate. I do not see any real sacral dimpling. There's no deep dimple, and the gluteal folds are symmetrical. I'm going to auscultate baby's breath sounds for 1 minute each, just like we did on the front. Very good. There's no rhonchi, stridor, or crackle. She sounds perfectly clear. Looking at the lower extremities, all across the back, there's no lesions, rashes, bumps, or any abnormal coloring. We're going to turn her back over and look at the front extremities. The legs appear symmetric. They're moving symmetrically. Once again, the color is pink with the acrocyanosis on the feet. The toes have no webbing. There's 5 toes on each foot. We're going to do the plantar grasp, pressing in underneath the toes, and she's grabbing my fingers. The Babinski reflex, the toes are flaring. Doing the head to ear, she's giving some resistance there. Very good. Range of motion of the knees is very good. Got full range of motion. And then we're going to do the Ortolani and Barlow's maneuvers. The Ortolani does the abduction. No hip clicks or pops there. And the adduction, there's once again no pops or anything either. The height of the knees is equal and appropriate for age. That's it.